Don't step on a crack, you'll break your mother's back. I don't want to break my mom's back. Oh my gosh, Mom, I don't mean to step on a crack. It's gonna be my fault. Why are there so many cracks?
Honey, come walk on the sidewalk.
There's so many cracks. Mom, I don't want to hurt you. Oh my gosh, Mom, I'm so sorry. It's my fault. I stepped on a crack. Mom.
I've had OCD since I was a little girl. Of course, I didn't know at the time what it was, obsessive-compulsive disorder, but I remember the first time a girl at school said, "Don't step on a crack, you'll break your mother's back," like we simulated in the video. And something kind of clicked, like, well, I don't want to cause harm, I don't want to hurt somebody. And so I became obsessive about cracks. And that's how OCD kind of started. And it became part of my life. Like, I just started avoiding things and doing things to avoid feeling like something bad might happen. And it progressed into the point where when I was in my early 20s, I really needed to start getting help. The more you avoid what's causing you anxiety, the more it builds and the more anxiety builds, until pretty soon I used to feel like I was smaller and smaller and smaller because I'm trying to control more and more and more, and I don't want to live like that. When I was little, it was my parents who said, we need to get her help. And so I always encourage parents out there to get your kid help. If I hadn't had parents that supported me on that and made me go in, I don't know what kind of person I'd be today. The other big thing that's helped me with OCD, which is huge, is the right doctor. I went through and interviewed and tried out some different doctors, and they didn't work for me until I found the one who did, and I've been with now for over 25 years. And when I say I've been with a doctor, it doesn't mean I'm going all the time. Like, if you have OCD, you gotta always be in therapy. It just means that I schedule routine appointments, more when I'm under a stressful situation, less when I'm doing better. But it's a doctor who has seen me through so that I can kind of keep in check and keep reminded of the tools. There are some things that have not helped me through the years. One is people who say, oh, are you being OCD? Just because somebody's OCD doesn't mean that if they're very attentive to detail or they're specifically focused on something that they're being OCD. So that is derogatory and it's not nice. The other thing is making fun of it. People will see somebody doing something and then, oh, is that you? Because you have OCD. It's like, no. Just because that poor person is like washing their hands too much does not mean everybody has OCD that washes their hands. So again, that's not nice, and it's being judgmental. It's just not supportive. So just to not criticize it, not judge it, not make fun of it. What does help is when a friend's like, okay, this sounds like this really getting to you. What are some of the tools that you use that help you with your anxiety and your obsessive compulsive? And they kind of turn it back on me to be more affirmative on what I can do to help myself. If you think you have obsessive compulsive disorder or are struggling with heightened anxiety, I just encourage you to get help and find the right doctor and take care of yourself. Don't beat yourself up over it. Just do what you need to do to get back on track and so you can live the life that you want to live. And if you know somebody who you think is unhappy and suffering from anxiety, potentially obsessive compulsive disorder, encourage them to get help, talk to them, and be supportive.
OCD is obsessive-compulsive disorder, and obsessions are thoughts that are unwanted and intrusive in a person's mind that create anxiety for that person regarding a specific topic. And compulsions are a behavior or a mental activity that that person does to alleviate the anxiety that comes from that obsession or thinking about whatever thing that might be. One thing with OCD is that it can look very, very different across different people. It may manifest itself very differently. I think when most people think of OCD, they think of the classic hand washing, or people who are afraid of germs or specific disorder or diseases and things like that. So they may wash their hands. I think that's what's kind of shown on TV a lot, is those people who wash their hands a lot. But the OCD may look very different than what you see on TV. People may do a number of things that you may not think of as being OCD, such as checking behavior is also very common. Checking meaning checking to make sure a door is locked multiple times, making sure, or checking to see if I turn the stove off. So a person might check the stove multiple times before they can actually walk away and not have any anxiety. Checking on their children before they go to bed. So anything checking behavior, washing behavior. But when I mentioned what compulsions are, I said, they can be a behavior such as checking or washing, but it also might be a mental activity. It can come in the form of like praying. So a person might feel they have to pray 5, 6, 10, 12 times before they can go on with their next activity in their day, or they might have to say something or have like a little mental ritual that they have to do before they feel that anxiety can go away and they can move on in their day. I think OCD is often one of those terms or disorders that's thrown out a lot. Kind of people say, oh, that's my OCD showing, or that's my OCD. There is that, I think as people, we all have those personality characteristics where we like things to be particular, or we just might be like a type A personality, we like things in order. But keeping in mind that true OCD will create a lot of anxiety, very distressing for someone who can't engage in that compulsion or mental activity that alleviates the anxiety. So, they may struggle to go on through their day, might have a full-blown panic attack if they're not able to check something multiple times. So it's a little more than, it bothers me when things are out of line, or I can't fold my clothes just right, because it creates a level of distress and it impairs functioning. It needs to impair someone's daily functioning, such as, they take several hours to get ready in the morning, or they can't leave the house without doing all these things, or their work day, their productivity at work is compromised because this activity, whether it be a physical activity or a mental activity, takes up a large chunk of their day and is just very distressing and draining. Our brain fixates on things. That's an interesting question, because there's a lot of different theories out there as to why a person who has OCD, why their brain picks that particular thing. Because in OCD, it's a person's obsession, that thing they keep thinking about, is often unrealistic or unreasonable, which differs from a person who has like generalized anxiety, which that's usually about normal daily life, like how am I going to pay bills, or the safety of my children. With OCD, it tends to be very unreasonable and somewhat quirky in a way, and we don't know why our brain tends to fixate on a specific something. There's a lot of different theories that there's this biological component or physiological component, and so I think it's our brain's way of manifesting, underlying things like some anxiety that had been already existing, or OCD's been known to show itself after a traumatic event, or a lot of environmental stressors going on at a particular time. So we don't know why it fixates on things, but I'm sure there's a lot of different components in there that, for whatever reason, that person's brain picks that thing to focus on. People can't just stop doing this because the anxiety that comes with not engaging in the compulsion. The anxiety is very, very overwhelming, distressing, And just like anybody, I mean, no one likes to feel anxious, particularly highly anxious. And if there's an option to do something to make that anxiety go away, I'm sure most of us would do that thing, especially if it's as easy as, saying a prayer or saying some words to ourselves or washing our hands or using hand sanitizer or whatever it might be. So a person can't just not do it without it interfering with the rest of their day if they haven't gone through treatment and really are working on overcoming their obsessive-compulsive disorder. Some of the stigmas around OCD is that someone may be doing this for attention, or that I think that they believe that this is something you can just stop doing, or it seems silly. So I think, and people often think it has to be a behavior such as hand washing or checking. People don't understand how it can show itself in many different ways that people may not always see. It might not be a behavior that a person's doing that's obvious to everyone else. It could be something like wiggling their toes that you can't see in their shoes, or doing a mental activity such as praying. There are 2 treatments for OCD. One of them is medication, which may alleviate some of the symptoms, and the other would be counseling or therapy with a mental health professional that would work on specific types of treatment, such as behavioral therapy, exposure and response prevention, which your therapist or counselor would be familiar with to walk you through that treatment. And it can be most effective if you often use those 2 forms of treatment together. So being on some medication while also going to counseling or therapy have been shown to be very effective in the treatment of OCD. The behavioral therapy for OCD tends to include learning skills, coping skills to help with the anxiety that comes with having to go through some of the treatment, because the name is exposure and response prevention. What that means is they're exposing you to what you're fearing, and the response prevention means they're not letting you engage in the compulsion that you want to do to alleviate the anxiety. So essentially, you'd probably experience some anxiety throughout this treatment, and you'd have to learn some skills and ways of managing that anxiety to not engage in the compulsion. And we want you to do that in a safe way. We don't want people inducing panic attacks, or that's why we encourage people to get help from a mental health professional in going through this treatment, and not trying to do this at home on their own, which I'm not saying you can't, but it might be difficult. An example might be for someone who washes their hands obsessively, would be, you start with a lower level of something that's a lower level of anxiety. So if that person says, I can't go, my worst fear would be going a whole hour without washing my hands. So whole hour would be the top of their anxiety. So we start a lot lower than that. We might start with, say, let's go 5 minutes of, maybe having you touch a doorknob and not washing your hands. And that person gets kind of anxious, and then we use some of the skills and to help them alleviate that anxiety without washing their hands. And then once that became comfortable, we might say, let's try to go 7 minutes, and then 10 minutes up until the goal that we're looking for. And desensitization is similar to the exposure and response prevention. You're just slowly introducing yourself to something to desensitize yourself to that thing. Some examples of tools or things you can do if you're living with OCD is to, I would say, get help sooner than later, because OCD is one of those disorders that the longer it goes, the worse it gets. It's a very chronic and can get very severe if you don't try to treat it as soon as possible. It just gets worse and worse and worse. And some of the tools you can use is probably really learning to be in connection with your body. So a lot of relaxation, mindfulness, yoga, things like that, I think could be very beneficial in learning to battle this disorder. To support someone with OCD, you would, similar to like a lot of other mental illness, be understanding that this isn't something they're choosing to do, that this isn't something that they can just stop doing, that it's a real threat to them, even though it might sound not make sense to you, might not sound reasonable, or kind of sound silly in a way. It's very important to be very understanding to this person that's struggling with this disorder. It is very real and very distressing for them. And so just to be accepting of that, and I guess asking them how could you be of help and of support, and encourage them to maybe get professional help if that seems necessary. One thing I encourage when I see people with OCD is that it's a very treatable disorder. It has a high success rate of treatment, and treatment sustaining itself over a period of time. And if there's a relapse or a slip, a person can very easily jump right back into what they've learned initially to deal with it and get back into that habit, and it should dissipate again as long as they're get on it as soon as possible. So there's a lot of hope with this disorder, and a lot of success. So there is hope for those struggling with this.